ladies and gentlemen, I apologize. We're getting a little bit of a late start, ran into a bit of a technical difficulty, but it's night one, so to be expected. We can only go up from here. If you haven't seen our videos already, my name is Patrolman Nick Fazio with the Plainsboro Police Department, and this is our first night of virtual interactive policing. This is an idea that's been kicked around a few times, and we were just trying to figure out the logistics on how to do it. We are very excited that tonight is the actual night, and we're very excited to have all of you here with us. I will just make note that all of the video is going to be recorded, and it will be posted in the Facebook Virtual Interactive Policing group for everyone to see and review their information as much as possible. Our chat administrator tonight is going to be Corporal Breda. If you guys have any questions, you can direct them to him, and he is going to put them out to the people who need to be asked the questions. You can also ask specific questions of the police department, and you could also ask specific questions of our special guest presenter tonight, who is Dr. Coleen Marchetta, and she's going to be getting us through some COVID-19 safety precautions. Sergeant Blanchard's going to do a full introduction for her. As of right now, I'm just going to let you guys know there's a decent amount of police officers in here with you as well. Everyone's excited to get this information out to you. This program is, as always, is going to be adapted to everything that you guys want as our VIPs. So please give us all the feedback that you can. Let us know how it's going, if we can improve on anything. Without further ado, I'm going to turn it over to Sergeant Eamon Blanchard. Thank you guys very much.
Hi, everyone. And just to echo Patrolman Fazio, we are so very happy to have you all here with us for our first virtual interactive policing program presentation on COVID-19 safety best practices. Before we introduce our presenter tonight, we'd like to thank the members of the Township Committee for their support of this program. It's very appreciated, along with Chief Tabner and all of the Plainsboro Township staff that helped us get this program off the ground. We're very thankful for that, and hopefully we have the continued success. Our presenter on this topic is a very special member of the community, and it's not going to be a stretch to say that she is one of the community's heroes during this pandemic situation. And I will now read her biography. I wish I can memorize it, but it's very impressive, so I'd like to read it. Dr. Coleen Marchetta, she is a DO, board-certified emergency medicine physician and a fellow of the American Academy of Emergency Medicine. Dr. Marchetta is currently practicing emergency medicine at Penn Medicine Princeton Medical Center in Princeton, New Jersey. She is also the medical director of Newtown Ambulance in Bucks County. She graduated from Philadelphia College of Osteopathic Medicine, hopefully I said that right, doctor, and completed her residency at Temple University Hospital in Philadelphia. She graduated magna cum laude from LaSalle University. As an emergency medicine physician, she has been an active member in her various hospitals. She was a member of the Emergency Medical Services Committee at St. Mary's Medical Center in Langhorne, PA, as well as the Bioethics Committee and Continuing Medical Education Committee in Doylestown, Pennsylvania. At her current hospital, she has been part of the Disaster Planning Committee that played an important role in planning and management of the COVID-19 pandemic. She is also a member of the Information Security Advisory Committee, as well as the Penn Medicine Emergency Department Enterprise Committee. She currently resides in Princeton, New Jersey with her husband and 4 beautiful children. And without further ado, I'd like to turn it over to Dr. Marchetta.
Hi, Kate.
We can hear you. Doctor, I don't know if, I think on your end it's freezing a little bit.
It's shy on my end, so I'm not sure if you can hear me.
We can hear you now.
You can hear me. Okay. So thank you for having very excited to speak. So, and we're just to give
Doctor, I don't know if you can hear me. We're having,
Can you hear me?
yeah, we're having some problems with the internet connection.
The audio.
We're going to try to get you on the phone.
Let me see. Okay.
Mute, doctor, please. All right, everybody. Like I said, night one, we're going to run into a little bit of an issue. We're going to try to get Dr. Marchetta's audio figured out here. In the meantime, we can just talk briefly about some police-related matters, police-related responses. I'm sure Corporal Reichert and Patrolman Ullum would be happy to help us out here while we try to get Dr. Marchetta and her presentation squared away. So obviously, as a police department, when COVID hit right about 1 year ago, we had to change the way that we operated. We had to change the way that we responded to calls. And that was not only for the safety of everyone that we were coming in contact with, but also for the safety of our officers to make sure that, one, we were protecting ourselves, and two, that we weren't spreading germs that didn't necessarily needed to be spread. So Corporal Reichert or Patrolman Ullum, you guys just want to talk a little bit and kind of give our chat a realistic expectation of what is happening nowadays if someone calls for a medical call, say, and the police have to respond to their house? Reichert, you want to?
All right. Hi, everybody. My name is Patrolman Brandon Ullum. Part of the Administrative Bureau here at the Plainsburg Township Police Department. During COVID, obviously, as Patrolman Fazio was saying, that if we can, when we come to a medical call, things are a little different now. Instead of, us just showing up on a whim when you call 911, obviously we're coming regardless of what the call is when you call 911. But now with COVID, we have to screen every call. So the dispatcher will screen the calls for service. They will ask you general questions if anyone in the household has had a fever recently, if they're having difficulty breathing, tight chest, any of the symptoms of COVID-19. When it comes to that, if the answer is yes, then obviously we're going to take all the precautions that we have in our power, wearing an N95 mask, gloves when we come into the household. If it's a non-emergent call and it's a medical call, say, where someone is just, they cut their hand, but they're not bleeding excessively, we're going to stage outside, make sure that when EMS gets here, obviously they go in and treat the patient. But in case anything turns for the worse before EMS gets there, that we are easily accessible for the caller to come outside and let us know that something is happening. Obviously, if someone is unresponsive or having a true medical emergency, regardless, we're coming in. But for any, I don't want to say minor calls, but a minor medical call, we might not necessarily be coming right in, but you will see us outside of your residence and there in case anything were to happen. The dispatchers do a great job of screening pretty much every single call we go to. If need be for other calls for service, we might ask you to step out of your house so we can speak to you outside, where we can socially distance 6 feet apart away from you, which is recommended for CDC guidelines. But other than that, we're normal operations. We're here for anything that you might need. And obviously, we're just one phone call away.
Solomon, Brandon, I appreciate it. It's nice to hear perspective from the OEM side, which is the Office of Emergency Management, which Patrolman Ullum and Corporal Reichert organized for us. I'm going to ask that Corporal Joe Breda add in on the same topic. Corporal Breda is in the patrol division, and he, as well as a sergeant on the squad, will lead that particular shift into their calls for service. Corporal Breda, do you have anything to add from the patrol side of it?
Thanks for adding me. Yeah, so as Patrolman Fazio said, I am Corporal Breda, and I am typically on the road. You'll see me driving around in one of the police cars, and during the day shift or night shift, all my guys have to make sure that they all have their equipment and we're socially distancing. So on our end, we're doing everything on our end to make sure that you stay safe as well as us. When we respond to calls, we are responding and we all have our masks. And if any of our officers need extra masks, I have them and I'm able to supply them, gloves and everything of that nature. But yeah, we are doing, we are up to date with all the latest from, executive orders from Governor Murphy, and it's filtered down to us from Patrolman Olam and Corporal Reichard. So we're doing our best to keep you safe and, try to get past this thing. We're getting there. So let's just keep going. Soon enough, we'll get back to normal.
Corporal Breda, I appreciate it. Like I said, it's always nice to have a perspective from multiple sides and just to see how this all comes together. And like I said, I'm sure everybody can understand that as much of an adjustment that it was in everyone's personal lives, it was also a huge adjustment for us, and not only us, but the EMS that respond out of here, the fire department who was responding. We all kind of got thrown into this just as the rest of the world did, and I don't think anybody was really prepared for this to happen. It's one of those things that you can't prepare for, and things changed all over the place. Corporal Reichard, would you mind talking about just how we came about some of the equipment that we received, as far as were things donated to us? Were they paid for in grants? Can you enlighten us on things along those lines?
Thank you, Patrolman Fazio. Yeah, so it was the bottom line came down to teamwork. We had a lot of donations. The community really helped us out in the beginning when we were all trying to figure out how to handle this or improvise and adapt to the situation we were given. But I got to tell you, it's teamwork. Number one, the community came out, supported us big time. We did ask for donations, or we sought out donations, and the community responded tremendously. So from there, we got together with our county, state, and federal partners, and we started getting things from the CARES Act or just from simple ordering and just going in for reimbursement. But the main thing was, like I said, we weren't like, if you said to me that we were going to handle a pandemic in the OEM world, I might have laughed it off a year ago. But now we've been through what we've been through. But like I said, teamwork and collaborations with county, state, federal, and more importantly, the community helping us. We got some of our PPE and we got the equipment we needed to get through it.
It sounds awesome. Sounds like everybody kind of came together to help us out a little bit. I believe we have our technical issues figured out here. I'm going to kick it back over to Sergeant Eamon Blanchard, and we'll give this another shot.
Okay, everyone. Yeah, we think we have it. So we're going to start on slide 3, please, for the doctor.
Let me know when it's up, when you're ready for me to start.
Yep, we're ready. We're live.
Okay, all right. Well, thank you again for having me. I'm sorry about all the technical difficulties. So I'm just going to get right into it. This is, again, a presentation about COVID-19 best practices and just some basic information about the 3 vaccines that are currently available. So it is known that the infection with SARS-CoV-2, the virus that causes COVID-19, can result in a range of illnesses from mild symptoms to very severe illness and death. About 30% of the persons infected with SARS-CoV-2 do not have symptoms. No one can predict how severe any person's illness might be, but certain factors may increase your risk. Some people are more likely than others to become severely ill when infected, such as older adults or people with certain medical conditions like diabetes, obesity, cancer, or heart disease. Next slide. The big delay. Okay. So how do we prevent COVID-19? Actions that everyone should take to help prevent COVID-19 are wear a mask that covers your nose and mouth, avoid close contact with others as much as possible, avoid touching your face, your eyes, your nose, mouth with unwashed hands, clean frequently touched surfaces, wash your hands often with soap and water for at least 20 seconds, use alcohol-based hand sanitizer with at least 60% alcohol and water if soap and water aren't readily available. And these are all tools in our toolbox. And the more tools we use to prevent the spread of the virus that causes COVID-19, the safer we will all be. Next slide. COVID-19 vaccination is a safer way to build protection. Getting the virus that causes COVID-19 may offer some natural protection known as immunity, but experts don't know how long this protection lasts, and the risks of severe illness and death from COVID-19 far outweigh any benefits of natural immunity. COVID-19 vaccination will help protect you by building immunity without the risk of severe illness. Next slide. All right, so the safety of COVID-19 vaccines is a top priority. 3 vaccines that have currently received emergency use authorization, or EUA, are the Pfizer-BioNTech COVID vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine. The Pfizer and Moderna vaccines are both mRNA vaccines, and they're given as a series of 2 shots into the muscle. Pfizer vaccine is given 21 days apart, and the Moderna vaccine is given 28 days apart, and the Johnson & Johnson vaccine is the viral vector vaccine given on an adenovirus, which is the virus that causes a common cold, and that's given as a series of 1 shot. Next slide. So COVID-19 vaccines are being held to the same safety standards as other routine vaccines. Several experts and independent groups evaluate the safety of the vaccines being given to people in the United States. Before any vaccines receive authorization or approval, the FDA carefully reviews all of the safety data from the clinical trials, and the Advisory Committee on Immunization Practices, or the ACIP, which is an independent body of experts, reviews all of the safety data before recommending use. FDA and ACIP have qualified scientific and clinical experts with minimal conflicts of interest reviewing all the data. After any vaccines are authorized and in use, both the FDA and the CDC both continue to monitor the safety. Existing systems can rapidly detect possible vaccine safety problems. These systems are being scaled up for COVID-19 vaccine introduction to fully meet the needs of the nation. Additional systems and data sources are also being developed to further enhance safety monitoring capabilities. There are systems in place that allow the CDC and the FDA to watch for safety issues. The CDC is using a program called BeSafe, which is a smartphone-based program that after vaccination, the health checker for people who receive COVID-19 vaccines, it uses text messages and a web survey from the CDC to check in with people who have received the vaccine following the vaccination. And BeSafe also provides second vaccine dose reminders for those who are receiving the Moderna and Pfizer vaccines, and a telephone follow-up for anyone who reports a medically significant or important adverse event. The Vaccine Adverse Reporting System, or VAERS, is the national system that collects and reports healthcare from healthcare professionals, vaccine manufacturers, and the public of any adverse events that happen after vaccination. Reports of adverse events that are unexpected appear to happen more often than expected or have unusual patterns are followed up with specific studies. And you can register for these programs through the CDC website. Next slide. So how do the COVID-19 vaccines work? So for the Pfizer and BioNTech vaccine, as I mentioned earlier, they're both mRNA vaccines. And it's a type of vaccine that's protecting against infectious disease. It triggers an immune response. To trigger an immune response, many vaccines put a weakened or an activated germ into our bodies, but not the mRNA vaccines. Instead, the mRNA vaccines teach our cells how to make a protein, or even just a specific piece of a protein, like with the Moderna and Pfizer vaccines, and that triggers an immune response inside our bodies. So that immune response, which produces antibodies, protects us from getting infected if the real virus was ever to enter our bodies. Next slide. So the COVID-19 mRNA vaccines do not affect or interact with our DNA in any way. The mRNA never enters the nucleus of the cell, which is where our DNA or our genetic material is kept. The cell breaks down and gets rid of the mRNA soon after it is finished using the instructions. Next slide. So the Johnson & Johnson vaccine does not use mRNA. Rather, it's known as an adenovirus vector vaccine. So it uses a more established approach of employing a harmless cold virus to deliver the gene that carries the blueprint for the spike protein that's found on the surface of the coronavirus. And so that's the similarity for the mRNA vaccines and the Johnson & Johnson vaccine is that they're both using the spike protein to fight the infection. And the spike protein is what the virus uses to enter the cells of our body. So the virus enters the cells, which then follows the genetic instructions to construct a replica of the coronavirus spike, and then the immune system uses these replicas to recognize and respond to the real thing. Other approved viral vector vaccines include the Ebola virus vaccine and the Zika virus vaccine. Next slide. Okay, so which vaccine should I get? Unfortunately, right now, you're not going to have a choice as to what vaccine is available to you. If you're comparing the efficacy of the two mRNA vaccines to the J&J vaccine, it's really challenging because there's a significant difference in the designs of their phase 3 clinical trials. Essentially, the trials were testing for very different outcomes. So with the Pfizer and Moderna trials, they both tested for any symptomatic COVID infection. Pfizer started counting symptomatic infection from 7 days after receipt of the second dose, and Moderna waited 14 days to start counting the cases after the second dose. J&J, by contrast, sought to determine whether one dose of the vaccine protected against moderate to severe COVID illness. And this was defined as a combination of a positive test and at least one symptom, such as shortness of breath or chest pain. And that began at 14 or 28 days. They tested both after a single shot. So because of the difference in the trials, making a direct comparison is a bit like comparing apples and oranges. Additionally, Pfizer and Moderna's vaccines were tested before the emergence of this troubling new variant that we're seeing in Great Britain, South Africa, and Brazil, whereas the J&J vaccine was still being tested when these variants were making their rounds. And much of the South African arm of the trial were actually infected with this new, more infectious variant. The two mRNA vaccines were tested earlier in the pandemic, so thus the exposure to the different variants isn't really known with those two vaccines. So you can see they're all very effective at preventing disease. The Moderna vaccine at day 14 was 94% affected. Pfizer at day 7 and 14 was 95% effective. and J&J was 85% effective, again, protective against severe disease. And there were no hospitalizations or deaths in the vaccine arm of the J&J trial after the 28-day period. So the bottom line is take the vaccine that you're offered. They're all safe and effective. Think about these vaccines like the flu shot. You know, most of us don't ask which company manufactures the flu shot that we receive. We just know that it works. There's advantages to all of the vaccines. And again, since they haven't been studied head to head, we don't really know exactly which one is the best and for whom. And right now, supply is really a limiting factor. Most people aren't going to have a choice. So get any vaccine as soon as you can. Getting a high level of immunity right now protects others around you, and it also helps us to reach herd immunity sooner. Next slide. Okay. It's easy to be confused by all the information that's circulating, some of which is conflicting. Some of the key facts or myths to be busted are that the COVID-19 vaccines will not give you COVID. People who have gotten sick with COVID may still benefit from getting the vaccine. Getting vaccinated can help prevent you from getting sick with COVID-19, and COVID-19 vaccines will not cause you to test positive on COVID-19 viral tests. Next slide. I think you guys may be a couple slides behind me.
We're on herd immunity. They're here. Herd immunity.
No, COVID-19 vaccination will help protect you from COVID-19.
Okay.
I think you're two slides behind me.
2 slides behind.
I think I forgot to say next slide. That's my fault.
The doctor's always right.
Yeah, I don't think so. All right, so COVID-19 vaccination will help keep you from getting COVID-19. Getting a COVID-19 vaccine will help create an immune response in your body against the virus without having to experience the illness. Based on what the data that we've seen, experts believe that the COVID-19 vaccine may help you from getting seriously ill even if you do get COVID-19. Next slide. I remembered that time. All right, so what to expect before, during, and after COVID-19 vaccination. So before vaccination, you know, just go online, learn more about the different types of COVID-19 vaccines and how they work. And I provided a lot of this information in the presentation. During your appointment, you should receive some paperwork or an electronic version of the fact sheet specific to the vaccine that you're getting. And this will help you understand the risks and benefits of receiving the specific vaccine. After you're vaccinated, you should be given a vaccination record card, and that tells you which vaccine you received. And if you're getting one of the 2-shot series, it will tell you when your next shot should be. Afterwards, you should enroll in BSafe, which is the CDC program tracking any adverse events. It's free. It's a smartphone-based tool that uses text messaging and web surveys, as I mentioned previously. And you can get this information on the CDC website. Next slide. So COVID-19 vaccination is a really important tool in helping to stop this pandemic, and it continues to be one tool in the toolbox. So while the vaccines appear to be very highly effective, additional preventative tools remain important to limit the spread. And this is a combination of getting vaccinated and following the CDC recommendations to protect yourself. As I mentioned earlier, simple things like washing your hand, social distancing, covering your nose and mouth with a mask, and cleaning and disinfecting frequently touched surfaces. It's going to take time to vaccinate all of the people living in the United States, as we're seeing, and we're experiencing a lot of hurdles with the rollout. But while the vaccines are being delivered, it's important that everyone continues to take all steps to prevent the spread of infection, and that includes people who are vaccinated. Next slide. So the vaccination can protect you, your family, your friends, and your community. Choose to get vaccinated, participate in Be Safe, and help the CDC monitor for any health effects after vaccination. Share your experience with your coworkers, friends, and family, and visibly show that you received the vaccine by wearing a sticker or button. You have a really important role in increasing confidence in the COVID-19 vaccination, and sharing your experience can influence those around you. Next slide. And again, you can find more information on the vaccines on the CDC websites. If you just click in, if you Google CDC COVID-19, it'll link you directly to the vaccine websites. Next slide. So the New Jersey Department of Health is rolling out COVID-19 vaccines in a phased approach to all adults who live, work, or who are being educated in the state. Within 6 months, New Jersey aims to vaccinate 70% of the adult population. And you can find more information regarding the vaccines and the rollout through the New Jersey Department of Health website, which is covid19.nj.gov/vaccine. Next slide. I think you guys are a couple slides behind me again.
We're on COVID-19 vaccine registration, doctor?
No, NJ Department of Health COVID-19 vaccine website.
Yep. Okay.
Sorry.
Oh, that's all right.
Next one.
Next. Is it the registration one, doctor?
Yes.
Okay.
Okay. So you can pre-register for the vaccine by following the links in the vaccine information website, or you can go directly to the COVID-19 vaccination registration website, which is covidvaccine.nj.gov. And again, if you just Googled COVID vaccine New Jersey, it would link you directly to that. So filling out the form, it takes approximately 15 minutes, and all of the information is private within the state of New Jersey. Next slide. So where can you get vaccinated? Vaccines are available currently to paid and unpaid healthcare workers, residents and staff of long-term and congregate care facilities, first responders, individuals over the age of 65, individuals 16 to 64 with certain medical conditions as defined by the CDC that increase the risk of severe illness from the virus, pre-K to 12 educators and staff, and child care workers in licensed and registered settings. Next slide. Where, how, and when can I get vaccinated? So beginning March 15th, the following groups will be eligible to book vaccine appointments: transportation workers, additional public safety workers, additional high-risk individuals, so they're expanding the medical diagnosis starting on March 15th to include asthma, Down syndrome, anybody with a BMI greater than 25, type 1 diabetics, and people with hypertension. And beginning on Monday, March 29th, frontline essential workers in the following categories are also eligible. So that includes food production and agriculture distribution, social services, anybody who works in warehousing, elder care, clergy, people who work as part of the judicial systems, elections personnel, medical supply chain, and postal and shipping services. Next slide. So where, how, and when can I get vaccinated? If you're eligible to receive a vaccine, there's generally 3 ways to get vaccinated. You can make an appointment directly with one of the many designated vaccination sites across the state. You may contact the site that is administering the vaccine directly, and you can find a full list of the designated vaccination sites on covid19.nj.gov website. Many of the sites are fully booked, but they do release new appointments almost daily because they never know how much vaccine they're receiving in the shipment. So it's really important that if you're having difficulty getting an appointment, that you're checking the websites frequently as more appointments become available pretty much daily. Pre-register for the vaccine on the NJ vaccine scheduling system, and you can get notified if an appointment is available to you. And then you can also select any healthcare facilities and hospitals that are offering vaccines directly to their workers, and you can contact your employer if you are somebody who's a healthcare worker. Next slide. So New Jersey has developed a really big network of vaccination sites to serve those who are currently eligible to get the vaccine. These sites include acute care hospitals, large state coordinated mega sites, county and local sites, retail pharmacies, and other medical locations. They have these mega sites that are hubs for the critical network of over 200 sites that are tasked with carrying out the state's COVID-19 vaccination plan fairly and equitably. Next slide. No one's going to have to pay for the vaccine itself. All providers must vaccinate individuals regardless of whether they have health insurance coverage or what type of health insurance they have. Next slide. So there are side effects to getting the COVID-19 vaccine, and they're expected. So when the body's immune system mounts a response to a natural infection or a vaccination, the result is usually you get local or systemic, so your whole body inflammation. The most common side effects include local inflammation at the injection site, which includes a sore arm, redness at the injection site, or some swelling. You can also have some swollen lymph nodes in the arm that's affected that you get the shot in. Some systemic signs include fever, muscle aches, chills, and headache. So the stronger the immune response, the more prominent the side effects. But it doesn't mean that if you don't experience side effects that your immune system isn't working. We're seeing that younger people seem to have a more robust response to these vaccinations. So it takes time for your body to build protection after any vaccination. And so in general, what we're saying is that it takes about 2 weeks to protect yourself from the virus once you get vaccinated. Next slide. So if you experience a fever after vaccination, stay home from work if you can. Most side effects don't last very long. The vaccine cannot give you COVID-19. However, you could have been exposed to the virus before you were vaccinated. So if you continue to feel sick, you should consider getting a COVID-19 test. And the CDC and FDA really are encouraging the public to report any possible side effects to the vaccine adverse event reporting system. Excuse me. Next slide. All right. Thank you. I know that was a lot of information, so if anybody has any questions, I'm here to respond.
Excellent.
And I'm sorry for the technical difficulties.
Doctor, we appreciate it very much. I know Corporal Joe was fielding some questions while your presentation was going on, and obviously we held them because we didn't want to interrupt the wealth of knowledge that you just gave to all of us, which we are very appreciative of. I'm going to turn it over to Corporal Joe Breda, and I know he's got a couple questions for you if you don't mind answering them for us.
Yeah.
All right. Thank you, Doctor. Great presentation. Actually, you just touched on the, I believe it's called VAERS, or the Vaccine Adverse Event Reporting System.
Yeah.
We had one question regarding it. Somebody asked, hang on one second, regarding VAERS, what should we expect if we report any issue with the vaccine? Then what? what will happen after you report something?
So you would get a text message just for follow-up, typically. So when I got my vaccine, I reported my side effects, and I just got a text message following up saying, did the side effects go away? I think if you end up reporting an atypical side effect, then you would be contacted directly by the CDC or the FDA for follow-up.
Who asked that question? Let me know if that answered it, because we have a couple more questions, and if not, I can ask a follow-up question to that. This one is for Corporal Reichard. Stand by. Okay, this question is, sorry. Is there, let me see. Sorry. Okay. Is the state looking to streamline the vaccination process? Folks are online for hours trying to get a vaccination slot. The process is very frustrating.
Okay, excellent question. And I know a lot of people are frustrated out there. The simple answer is yes. Had a couple of conference calls earlier today, and a lot of it was about that. As the doctor said, hopefully next couple of weeks it'll start to speed up, and more sites will open and more vaccine will come online and we can push it out. I don't like to sit here and just say like, yes, they're looking to streamline it. But here's the thing. The best advice I could give to them is think about it as old concert tickets when you used to sign up and try to go to a concert and try to get a ticket. Sign up where you can, get on as many sites as you can, and just keep going and looking. The doc touched on it great. Sometimes if you visit a site 2-3 times a day, you could probably get an open spot, or hopefully get an open spot to get a vaccine. So the simple answer is yes. We're looking to streamline it. It's a little bit above us right now. However, keep checking those sites. Sign up where you can. I know there's a bunch of sites, especially on the NJ vaccine main site. Just keep signing up and checking the site, and more. Hopefully, you get an open spot. That's the best answer.
Right. Thank you, Corporal. This one's for Doctor. The question is there any way to ensure African Americans that take the vaccine is safe given the hesitancy to take the vaccine in the community? Thanks again.
Sorry, can you repeat that?
As a doctor, is there any way to ensure African Americans that I believe take the vaccine? It says that the vaccine is safe given the hesitancy to take the vaccine in the community.
That's a great question. I can say that among all of the vaccine trials that there was a diverse population that was involved. I don't know the exact percentages, but I know that there were a large number of minority, Black, Hispanic, that were involved in the trials. And it was proven to be safe and effective. I can tell you personally that I have many African-American Black physicians that have been vaccinated and have been vaccinated now for a couple of months. So I hope that kind of provides you with some assurance. But I do know that all of the trials really had a diverse population involved in getting the vaccine and in all the studies. I hope that's helpful.
Thank you. Another question. I think this is back to the vaccine adverse event reporting system. Is VSafe different than that? The example is my husband had a fainting as a side effect and did not get a follow-up call.
Which one did they report it through, VSafe or VAERS? They're two different reporting systems.
VAERS.
So VSafe is the smartphone-based one that when you get the vaccine, you just sign up for. And VAERS is the adverse event reporting system. So based on how significant your symptoms were. That's what you would report through theirs. Any adverse events, like an allergic reaction.
Thank you.
Excellent.
Let me see here.
We'll go with one more, Joe.
Yep, that's what I have here. And one more is, how long should you wait to get other vaccines after receiving the Void vaccine?
I don't know any data on that, on how long you should wait to get other vaccines. I would say since these are fairly newer vaccines, I wouldn't get multiple vaccines at once because you're not sure what the reaction is going to be from. But I think following your vaccination, I would just contact your primary care physician, your healthcare provider, regarding any other vaccinations that you want to get. I don't think there's any really data on that right now, and it's such a new vaccine. I know that they wouldn't be administering like a flu shot with the COVID vaccine, but there hasn't been any guidance onto you have to wait a certain amount of days to get, a shingles vaccine. There's been no data on that.
All right.
Excellent. Well, Doctor, we want to thank you very much on behalf of the Township of Plainsboro. You are a true treasure to Plainsboro. You keep us healthy and safe throughout the years, especially during this pandemic. And we really, really appreciate your time here tonight. And thank you so much for helping us out, especially with the technical difficulties. So the work ended up working out. So we really appreciate your time here tonight.
Thank you so much for having me.
Thank you, and please be safe. And obviously, if any,
Everybody stay safe.
thank you.
Thank you.
So thank you to everybody who showed up here live tonight. We'll be posting this recorded the recorded presentation on our Facebook page. I'll allow Patrolman Fazio to go into details, but again, thank you very much for our first virtual interactive policing session here. We hope to have many more throughout the upcoming months, and some very serious and interesting topics. And again, thank you to all the Plainsboro Township staff, to the Township Committee members, and to Chief Tabner for supporting us in this project. And thank you to all the officers who showed up and answered questions tonight. We really appreciate it. And hopefully the program is very successful, and the community gets a lot out of it. So, Patrolman Fazio.
Thank you very much, Sarge. Appreciate it. Everybody, like I said, it's night one. We didn't expect it to go perfectly, and I appreciate that everybody hung in there with our technical difficulties, especially our VIP members. We see you guys in the chat asking questions. We see you in the members page here. We very much appreciate it. Like I said earlier, this program is built for you, every one of our VIPs here. So feedback is going to be huge for us as far as tailoring this program to be exactly what you want it to be. If you guys and girls have topics that you think the police department needs to address in a presentation, please let us know that. I am in charge of the Facebook group. You will be communicating directly to me every time that you post. Right now, my game plan for that group, which if you don't already have it, it's very simple to find. It's visible to everyone. You just have to go into your Facebook search bar, type in Plainsboro Virtual Interactive Policing, and it'll pop right up on the screen. You'll see a picture of one of our police cars. It's in the night in the snow, and luckily the weather's breaking, so maybe we'll update that picture for some nice warm weather, maybe some palm trees, if we could find some in New Jersey. But join the group. It's going to ask you 3 questions right out of the gate. Those questions are going to come to me. I'll review it. I'll get you guys in the group. And from there, all of the videos that we film and we record here are going to be posted. So getting back to where I was saying, the best way for you to communicate with me is to comment on those videos. I'm going to review each one of them. I will try to be as responsive as possible. Obviously, I do have to get some sleep sometimes, but my phone is always with me and I have it linked with me. So I don't need to be working or on duty to be able to communicate with you all. Other than that, I just hope you guys get into the group. I hope you enjoyed our presentation tonight. I want to also piggyback off of Sergeant Blanchard and thank everyone from our staff and our township that joined in tonight and that allowed this program to get started in the right direction, I think.
And if anybody wants to have any more information, any additional updates and info on COVID-19, please visit the township website at plainsboronj.com. All the up-to-date information will be posted on there.
All right, everybody, that's going to end our meeting tonight. Like I said, night one in the books. We'll keep going from here and see what we can build. Thanks very much for showing up, everybody. Have a good night.
Good night.